Tumor necrosis factor inhibitors for inflammatory bowel disease. A 35-year-old man presents with an exacerbation of Crohn's colitis. He received a diagnosis of Crohn's disease 8 years ago and has been treated on 3 previous occasions with prednisone because of a resurgent need for glucocorticoids. Treatment with atitropine was started 1 year ago. He now reports abdominal pain in the right lower quadrant, which developed a week ago with an increase in stool frequency and 8 to 9 stools per day. Laboratory tests shown a hemoglobin concentration of 10.7 grams per deciliter and a C-reactive protein level of 21 milligrams per deciliter. Magnetic resonance tomography shows inflammation located to the distal ileum and colon. The patient is referred. The clinical problem: inflammatory bowel disease and umbrella term for a range of diseases of which ulcerative colitis and Crohn's disease are 2 prevalent entities, is a common chronic gastrointestinal infection. Pathophysiology: the general hypothesis is that inflammatory bowel disease develops as a result of a persistent inappropriate perturbation of this complex interaction, resulting in changes in the microbiome and its mucosal inflammation.
Hi, I'm Dr. Mike Evans, and this is a brief overview of a disease that attacks our gut, called inflammatory bowel disease, or IBD. It is actually not a single disease, but rather refers primarily to 2 related but distinct diseases. One is called Crohn's disease, and the other is called ulcerative colitis, or UC. The key differences are firstly the location of the inflammation, and secondly, the extent of the inflammation. Ulcerative colitis only affects the colon, or large intestine, while Crohn's disease can affect the entire digestive system, from the mouth to the anus, or as we say, from gum to bum. In ulcerative colitis, inflammation only involves the inner lining, or what we call the mucosa, while in Crohn's disease, inflammation can extend right through the entire thickness of the bowel wall to the outermost layer of the digestive tract. These differences lead to different outcomes and different treatments, which I'll get to later. The major symptoms of UC and Crohn's do, however, overlap. These include stomach pain and change in bowel habits. Almost always this means more urgent. Other symptoms include weight loss, increased appetite, fever, night sweats, extreme tiredness.
In the clinical evidence, several placebo-controlled trials have shown that infliximab, adalimumab, and certolizumab are efficacious in the treatment of moderate to severe Crohn's disease, both as first-line therapy and in patients with inadequate responses to the standard treatments.
What is Crohn's disease? Crohn's disease is a chronic condition characterized by inflammation in the gastrointestinal or GI tract, which is also known as the digestive tract. Since Crohn's disease is a chronic illness, it is persistent and will be present throughout a patient's life. However, patients and physicians can work together to manage the symptoms of this disease. The GI tract includes the mouth, esophagus, stomach, small intestine, large intestine, and anal region. Crohn's disease can affect any part of the GI tract, but the most common location is the last part of the small intestine, which is called the ileum, and the first portion of the colon, which is also referred to as the large intestine. Current thinking is that Crohn's disease is a genetic disease caused by abnormal regulation of the immune system. The GI tract is frequently confronted with bacteria from our diet and environment. Many